Hi, everyone. I'm really excited to be here today with one of my colleagues to talk to you about the data challenges within the CNS space and some technology solutions that we have for you. We'll get into some quick introductions. So I'm Heather DiFrusicia. I'm the Associate Director here of RTSM IWRS, so everything relating to inventory and enrollment management. And I also have Kaitlyn Townsley with me. You want to go ahead and introduce yourself?
Yeah, hi everyone. It's a pleasure to be here with you today. So my name's Kaitlyn and I'm the Associate Director of Product Innovation here at Axiom. So I work on different data solutions for different clients and helping to enhance our technology.
And of course, she's going to be talking to you, and I will be talking to you as well about some of those solutions specifically tailored to you. So a little bit about Axiom. So when we're talking about studies and our largest randomized trials, so 700 plus studies, up to 40,000 subjects for our largest trial, many therapeutic areas, and of course, we're coming up to our 20th anniversary. We'll talk a little bit more about Axiom later on today, but we'll start with talking about you in the CNS space. So what are some specifics about executing a CNS trial? So one thing we always want to be considering is our stakeholders. When we're talking about stakeholders here, one of those additional stakeholders is our caregivers. So when we're talking about our goals, we really want to decrease the burden on, of course, the sites and subjects, as we always do, but also include the caregivers in that. Another big stakeholder are labs and biomarkers. So how can we bring that data together, that specialized data, so then you can focus on decision-making, risk mitigation and management, as well as, of course, timely end-of-study submissions. So our data challenges, there's really three key ones that we want to talk to you about today. We have our IP compliance and accountability, the easy questionnaire formats, as well as data from multiple sources, as we were touching on. So let's talk about solutions. So our first one, our IP compliance and accountability. So it's really about subjects remembering to take doses at home, of course, when we're talking about the CNS space, especially in studies such as Alzheimer's studies. Additionally, of course, that often falls on the subject caregiver then when it comes to compliance and home accountability. And of course, that's specifically important when we're talking about paper patient diaries, but we're going to talk to you about some other solutions. Kaitlyn?
So just thinking about how are we going to help patients remember to take their doses if it is an oral medication that they're taking at home, for example. So one thing that we can do is we can use an ePRO tool to help track all of those doses and reminders. So using an eDiary type of solution, we're going to be able to help improve subject IP compliance overall. So letting the subjects track when they've taken their dose, sending reminders to any subjects who hasn't taken their dose. So maybe if they haven't recorded their morning dose, for example, within a certain number of hours, sending that reminder to help remind them to record it or remind them to take that medication. And that's obviously going to support both the patient and the caregivers with the compliance of that IP. And being able to send those notifications in real time is really helpful, just because you're not waiting till the next day when maybe the site sees that they missed that dose last night. We're actually in a position where we can correct that IP compliance in real time rather than having to correct it moving forward. So it's really helping have that real-time IP compliance and oversight. So also, we're also not having to wait for sites to enter that data even a few weeks later or at their next visit. So all of that data can come in real time, not just for the patients as notifications, but also for all of our team members who are overseeing that data. So whether that's the site, the CRA, the sponsor, having early access to any cure risk indicators for that study oversight. And that's obviously going to be critical for all of our study analysis, making sure our IP compliance is nice and high. So just touching on ePRO tools. So this is ours. So we have a mobile application that can be used on an Android or iOS phone that can either be subject provided or we provide it for different projects. And basically, it's a really, really simple, easy diary for patients to complete. They have access to a customer care team who are available 24/7, not only to answer site questions, but also directly to subjects. So a lot of times in an eDiary solution, we're actually relying more on the site to actually support their patients with this additional technology. But this is a little bit different. We want to remove that burden from the site, as Heather mentioned earlier in the presentation. We want to make sure we're keeping that burden nice and low while making it easier for the subject. So customer care is going to help take care of all of that. So these are just some samples of a notification. So if we are using a mobile app, we can, of course, send notifications through that app to the patient. So here we have a reminder to take their daily dose. Also, if you're doing any changes to dosing, we can remind the patients that they need to make those switches. So if we're titrating doses, for example, you can remind the subject, instead of taking 4 pills today, we're going to take 2 pills, or whatever the information might need to be. As much as the site has discussed it with the patient and it's discussed it with the caregiver, it's nice to have that real-time reminder to make those changes, that we're still tracking that IP compliance correctly, and we're going to have those PKs overall if needed. So again, really simple questions. So in this case, we're asking the patient, did you take your dose or not? You could have it super simple, and if they say they took their dose, that could be all you want to capture. You can also ask more specific questions, like how many pills did you take? Depending on what the indication is, you could ask them how they're feeling. But basically, it gives you an opportunity to collect additional information about that patient, about the doses that they're taking, and then having that ability to see that in real time. So as the data is being entered by the patient, it's actually syncing to the Fusion platform. And if we go to the next slide, you'd be able to see all sorts of different dashboards on what that compliance looks like, or reports or notifications, whatever is going to be easiest to help you and your team. But in this case, we're looking at samples, dashboards of subject compliance below and above 80% and 120% respectively, so identifying issues with individual subjects. We're also looking at sites that have compliance below 80%, so maybe it's actually not retraining on the patient side, but retraining on a specific site, so that they can help manage, and we can help them manage their patients and have our compliance nice and high.
Absolutely, and just to add to that, of course, we can't forget about the physical accountability piece. So of course, utilizing the IRT, the inventory management system, to be able to confirm what was expected versus actual. And of course, your kind of be all end all is also your PK data, which sometimes that's what you need to be able to determine that true compliance. So when we're looking at the kind of scale of things, we have those paper diaries, which of course are still often used. But as you heard from Kaitlyn, the option of utilizing the electronic capturing of the diary really adds to the level of oversight, the level of compliance, because there's those reminders as well as the visibility. The physical accountability, when it comes to your data, it's only as good as, it's only as accurate as it is entered. So the physical accountability is that reconfirmation that yes, the compliance is accurate. And of course, that last piece is the PK data. But again, when we're looking at these pieces of technology and capturing these data points, then it all still comes back down to the support of the patient and the caregivers, making sure that we have that ongoing compliance and we're making it easy as possible for them to track it. The other aspect is when we're talking about the visit and end of study checkpoints, those are key to the compliance oversight, of course, for physical accountability and the PK data. And it's really just confirming the compliance and also allows you to investigate any anomalies. And again, that kind of loops back to that theme of it being critical to the study analysis. So moving on to our data challenge number 2, so easy questionnaire formats. So when we're talking about the CNS space, then we can have challenges with patient dexterity and or comprehension. Is the site needing to follow up with the subject on completion of the questionnaires, as well as the timing that it can take for the site data entry and our data review if it's being transcribed. Kaitlyn?
Thanks, Heather. To help with this, instead of using a paper questionnaire, we would talk to, or speak to rather, using an electronic solution again, surprise, to have an ePRO questionnaire on maybe a tablet. So this is going to help overall with subject compliance. So making sure that they answer all of the questions, not allowing them to move forward without completing all of those, making it really easy for subjects to use. So having larger screens, easy questionnaire formats, pushing a button and selecting number 2 versus having to write number 2 or fill out a bubble with a pencil or a pen. So just letting it be easier for the subject overall on how they complete that data. So taking away kind of the stress of having to fill out a questionnaire for some of these patients will allow them to better answer the questions. If they know, okay, I don't need to worry about, writing a number 2, I can just go ahead and select 2. And then as Heather mentioned, we're also, by switching to electronic method, having that questionnaire data entered directly into the tablet allows us to skip the step of having the site manually data enter that. So having the site enter that information, it doesn't add anything to the study. It actually just adds more work, if anything. So having the sites have to interpret what was said or written, if they maybe didn't realize but the patient missed a question, them having to go in, do that data entry, figure out everything, it just adds more time. And then also that's going to increase the amount of data review that your CRAs or monitors are going to have to do as well, checking against that source. So just kind of removing some of that burden on the site and the CRAs and allowing them to focus on the other aspects of the trial. So again, this is a sample of our ePRO for a web portal or for a tablet. So it can be used on any tablet or iOS device. Again, Axiom provided, site provided, sponsor provided, and again, having that customer care support. So if you do have a site who is, a subject who is at the site trying to enter a questionnaire, obviously the site coordinator hopefully will help them out. But if they get stuck, having the customer care team available to answer their questions 24/7.
Absolutely. So just transitioning into our third and final study data challenge for today, and that's having data from multiple sources all coming together. So how can we centralize that with technology?
So to pull all of those data sources together, a lot of people take the approach that, you kind of send all of that data to biostats and they magically put it all together at the end of the study when it's time. And in the interim, you can pull a report on your patient from EDC, and you can pull all of those different lab data points, et cetera, from the respective systems. And if you had to look at anything specific, you would ask biostats to put you together a patient profile report. Instead of that, we would recommend actually importing all of that data into a single platform, whether that's automatically depending on the vendor or if you're going to do periodic transfers. And we're going to import that all into one database. And what that does is it lets you have all of that data in one place, so you're not spending that extra time at the end of the study to combine all of that data coming from different places. And it's also going to allow you to see all of those subject trends in real time through reporting. So you don't have to wait a week for biostats to turn around a patient profile report. You can actually pull that in real time. That would have your EDC data plus your lab data, for example. Or if you were looking at any, perhaps if you were doing any gait analysis or any other sensor type data, you can pull all of that in as well to see all of that in real time. And then what that allows you to do is look at reports. So if we go to the next slide, this is a sample of a patient profile report. And if we look at the bottom here, you can see that the chemistry profile is pulling in all of that central lab data. So we have the regular EDC data at the top about this patient, and then all of that different information below. So it allows you just to have a better look overall at this particular patient. But you could also look at different trends or data analysis or analytics if you were looking at if they were taking their IP and if that's trending with what their PK data is, as Heather mentioned, as that extra confirmation to see if everything's kind of lining up and making sense as we go. It might be able to flag something and give you an opportunity to kind of look around and actually have real-time awareness of the data that's occurring in your trial. So we would recommend importing and aggregating as much of that data as early as possible to help you have that oversight in the process.
Okay, so we alluded to a little bit about Axiom, our approach to CNS studies, but we're going to talk a little bit more about that So we do have our platform Fusion, and it really acts as a connected hub for all of the study data, including ePRO data that we talked about, whether it's the web portal or the mobile app, the inventory management, the various data imports that are coming in. Everything is in one place. And here you can see it's not just in one place, of course, it's also a single sign-on. And you can see all of the various buckets that often ends up being siloed, but we're working to bring that all together. We do offer different configuration options. So of course you can just have a specific module, just ePRO, for example, just IRT, for example, or you can utilize EDC plus those selected modules, or take the most advantage in the third option, which is having that complete Fusion suite. And that's where you get all of the benefits of a unified platform. We take this approach also on the service side. So everything from biostats, pharmacovigilance, clinical monitoring activities, as well as data analytics, as Kaitlyn mentioned before as well. So we really focus on the data. And so providing that single sign-on access, the centralized dashboards, which we got to take a peek at, as well as the reporting, really bringing everything all together for you. You're not manually compiling the reporting. You don't have to specifically rely on the stats group to bring everything together and to wait for that to be available. It's all available at your fingertips. So 24/7 real-time access. Of course, it's data coming from the EDC, from your inventory, ePRO, etc. It really allows you to own that full cycle of the data. And of course, if you have visibility to it, then you have that active overview that you can see everything when it comes to the work being performed, whether it's the review, whether it's kind of comparing all of those compliance activities together. And of course, that means that you have awareness and access to your risks. It really brings together all of these different layers. So your clinical data, your reporting access, that unified platform, as well as the supporting services. And it comes together to be us here at Axiom. And the part that we didn't really mention before, but a critical part, is not only the technology, but also the people behind it, the team behind it. So that commitment to the success of the trial, of the indication and the therapeutic area, it's making sure that your trial is going to be run cleanly and quality data, and you have that real-time access throughout. So we just wanted to say thank you for your time today. We're so happy to be a part of a CNS Summit of not only today, but throughout the year as a community. And if you'd like to talk to us more about our solutions, you can email us at solutions@axiom.cc, and we're always happy to talk about it. Thanks, everyone.
And thanks, everyone.